Chapter 1: Questioning the Status Quo. Why, in a world brimming with advancements in medical science, does the field of psychiatry still struggle to comprehend the complexity of the human mind? A question that lingers in the air, unanswerable, yet demanding a response. Welcome to the exploration of alternatives to psychiatry. A journey that ventures beyond the conventional, challenging the status quo, and embracing the unconventional. Chapter 2: The Power of Peer Support. Consider the story of John. A man in his 30s, John grappled with debilitating anxiety and depression for years. Traditional psychiatry offered him a cocktail of medications, which brought temporary relief, but also a myriad of side effects. The breakthrough came when John discovered peer support. By sharing his experiences with others who had walked a similar path, John found understanding, empathy, and practical strategies to manage his mental health. He wasn't just a patient anymore, he was a participant in his healing process. Chapter 3: Trauma-Informed Therapy. Or take the case of Mary. A survivor of childhood trauma, Mary was diagnosed with post-traumatic stress disorder in her 20s. She spent years in psychiatric therapy, but the trauma remained, a constant shadow over her life. It was only when she encountered trauma-informed therapy she began to see a glimmer of hope. This approach recognized her past, respected her pain, and offered her a sensitive, compassionate path to recovery. Chapter 4: Holistic Health Approach. Then there's the story of Sam, a teenager grappling with body image issues in a world obsessed with perfection. Traditional psychiatry tried to fit him into a box, diagnosing him with eating disorders and prescribing medication. But Sam found solace in holistic health, an approach that saw him as a whole, not just his symptoms, but his physical, mental, and emotional well-being. He learnt yoga, changed his diet, and started meditating. It wasn't a quick fix, but it was a sustainable one. Chapter 5: Advocating for Change. These stories, and countless others, underscore the potential of alternatives to psychiatry. They highlight the power of peer support, the compassion of trauma-informed therapy, and the holistic approach of comprehensive well-being. They remind us that every individual is unique, with unique needs, unique experiences, and unique paths to healing. Yet, the fight for alternatives to psychiatry is not just about individual healing. It's also about social justice and human rights. It's about affirming the dignity of every individual, about ensuring fair treatment for all, regardless of their mental health challenges. So, today, challenge the conventional. Ask questions. Seek alternatives. Advocate for a mental health approach that respects individuality, promotes holistic health, acknowledges trauma, and fights for justice. Because mental health isn't just about diagnosing disorders and prescribing medication. It's about understanding the complexity of the human mind, about embracing the uniqueness of every individual, and about empowering each person to be an active participant in their healing journey. Chapter 6: Embracing Change. Dare to explore alternatives to psychiatry. Dare to challenge the status quo. Dare to reimagine mental health. The journey starts now.